Good afternoon and welcome to today's Georgetown Alumni webinar, hosted by Georgetown University's African American Advisory Board and the Georgetown University Alumni Association. Thank you for taking time out of your day to connect virtually with fellow Hoyas for today's program, The Impact of COVID-19 on Black Americans. Today's moderator is Soyica Colbert. Soyica is the Vice Dean of Faculty and Idle Family Professor of the College of Arts and Sciences at Georgetown University. She is the author of the African American Theatrical Body and Black Movements. Colbert also co-edited The Psychic Hold of Slavery. She is currently working on 2 books, Becoming Free, an intellectual biography of Lorraine Hansberry, and a co-edited collection, Race and Performance After Repetition. Colbert's research interest spans the 19th to 21st centuries, from Harriet Tubman to Beyonce, and from poetics to performance. I'm Chantel Pinckney, Associate Director of the Development Engagement for Alumni of Color, and I'll be facilitating today's program. Before we get started, I'd like to share a few tips and reminders. This webinar is being recorded, and the recording will be available on our YouTube channel within 48 hours of today's broadcast. You will receive a link to the recording in our follow-up email. Panelist bios can be found in the handout section of the GoToWebinar control panel. The panel will answer audience questions toward the end of the presentation. Please send in your questions using the questions section of the control panel. If you're having any technical difficulties or other issues, please also submit those concerns via the questions section of the control panel. Without any further ado, I am pleased to turn things over to Soyica Diggs Colbert.
Thank you, Chantel. It is my pleasure to help facilitate this conversation today, to moderate this conversation, which is about the impact of COVID-19 on Black communities. A recent study found that disproportionately Black counties, a 22% share of the population, account for over half of the COVID-19 cases in the US and almost 60% of the deaths. The pandemic exposure of deep gaps in overall healthcare access for Black Americans, in addition to the disparate impact of historic economic conditions, has led to increased focus on the intersections of race, class, and gender in the United States. Today's conversation will focus on these intersections, considering the specific life and death stakes of COVID-19 and also the deeper structures that it exposes, or what we might call this quick and slow death that racism causes. Before we jump into the conversation, I will introduce our guests. And just to reiterate, we will have about a 30-minute moderated conversation, which will be followed by your questions that the panelists will address. Our panelists include Kaya Henderson, who is the former Chancellor of DC Public Schools. She now spends her time supporting education initiatives around the world through Teach for All and consulting on leadership and education. Our second panelist, Professor Christopher King, is an associate professor and chair of the Department of Health Systems Administrations at Georgetown. Board certified in healthcare management, his work illuminates how structural, institutional racism, community dynamics, and healthcare norms contribute to racial differences in healthcare outcomes. L. Tony Lewis, MD, is a family and geriatric physician, wellness and yoga professional, political strategist, and global labor leader. In 2017, she co-founded the Health Equity Cipher with her partners to address health equity and justice by all means, from the streets to the suites. She founded Liberation Health Strategies in 2018 to holistically address the health needs of individual communities and organizations at the community level and around the globe. Our last panelist, Charlene Carver, is the founder and executive director of the Women's Economic Institute, a community-based think tank committed to closing the racial wealth gap for minority women entrepreneurs through policy, technical assistance, and economic development. Tarver is also the convener of the Black Arizona COVID-19 Task Force, a consortium of educators, physicians, CBOs, and public officials and health administrators lobbying the governor to provide testing in marginalized communities, moratoriums on rental evictions and utility shutoffs, and urging emergency assistance for small Black-owned businesses. It's my pleasure to welcome all of our panelists. So I'd like to begin with a question for Christopher. Much of your work has focused on studying health disparities and their causes and implications. Can you tell us some about your recent report, Healthcare Disparities in the Black Community, and how it informs our understanding of the COVID discussion?
Absolutely, thank you. Sure, earlier this month, we released our report. It's titled Health Disparities in the Black Community, an Imperative for Racial Equity in the District of Columbia. And first, I think it's important to note that when you look at the overall health profile of our city, we fare quite well. However, when health and socioeconomic data are stratified by race, there's an entirely different narrative. For example, when compared with white counterparts, the number of Blacks living with diabetes is 7 times higher, obesity rates are 3 times higher, death rates due to colorectal cancer 3 times higher. I can go on and on. But because socioeconomic conditions shape health, the report also highlights disparities in income and education. The median household income for white families is 3 times higher than Black families in the district, and 26% of Black residents have a bachelor's degree or higher compared to 90% of residents. So those of us who study racial disparities, after we learned about the transmission modality of COVID and the risk factors for mortality, what we are seeing in the Black community is no surprise to us. Many of us actually predicted this outcome. And in the report, we refer to this as a trifecta of conditions. One, the existence of high-risk living conditions that people have just to survive, and the pre-existing of chronic disease conditions and comorbidities. And the third is this limited access to high-quality care and the delivery of care that is racially biased or just not culturally tailored or culturally nuanced. As far as COVID, as of June 23rd, there's 10,128 residents who've tested positive for COVID. For point of reference, there's about 700,000 residents in the district. Blacks represent 50% of those who test positive. We've lost 541 residents due to COVID. 401 of those individuals were Black. This means Black residents represent 3 out of 4 deaths, or 75%. Why is this? Well, a few months ago, public health experts told Americans, stay home, practice social distancing. Well, this is very difficult if you're an essential worker and your employer doesn't provide you with the appropriate level of PPE. It's difficult if you don't have access to the internet, which has allowed so many of us to resume some sense of normalcy. It's difficult when you live in a multi-generational household or you live in a densely populated apartment complex. Social distancing is a privilege. And while access to testing has improved, it wasn't easy when all this started. Many individuals who displayed symptoms were told to go home, quarantine yourselves, a concept that is likely to be a challenge when you don't have the appropriate level of support or resources. We also know that in many cases, EMS would bring patients to the ER and they were already close to dying. These are the individuals who delayed care because of fear, or they were just, they were given the message to stay home.
Now that's very helpful, and it gives us a good landscape for not only understanding how we got here, but then also how we might imagine moving forward. And so in that thread, Kai, I wonder if you could talk some about what this moment with COVID-19 has taught us about education, and with so many school districts and universities pondering reopening in the fall, if you have any advice, predictions, and or insights that you could offer with regards to COVID and education.
Sure. I think, like Christopher, in education, many of the disparities between Blacks and whites or Blacks and anybody else are widely laid out, widely known. We call it the achievement gap. And what COVID-19 has done is, in fact, exacerbate the conditions under which the achievement gap will grow. My grandmother used to say, when America catches a cold, Black America gets pneumonia, right? And so this pandemic will have significant impact on education across the board, and it will necessarily impact low income and Black folks, all folks of color, in much more significant ways than it will white America. There's all of this research which shows that online schools that were designed to be virtual from the beginning are not particularly effective, and they're even less effective with young people of color and poorer populations, right? And we're not even getting online education that is actually designed. We're getting some jury-rigged, hamstring, MacGyver set of initiatives in education. When you look at how much time kids are spending on educational exploits, right? We're not spending an 8-hour school day. In fact, many schools are only offering a couple of hours worth of activities. And we know what happens to kids, especially our kids, when there's a break in school. We call it summer slide, and kids kids are predicted in this pandemic to lose anywhere from 20 to 50% of the learning gains that would have happened this year. When you look at things like Hurricane Katrina, right? It took 2 years just for the education system to come back online. And over the course of a decade, New Orleans kids still haven't recovered, no matter what some of these charts and figures say. And so, add to that the trauma of being away from school, away from people you care for, the ability to make friends, to go outside and play. Our kids are experiencing all kinds of social and emotional issues that won't get addressed in school. I mean, school is not going to reopen the way it was, right? And in many cases, you'll still only have kids going to school a couple days a week, or on a week, off a week, or any kind of, configuration of schedules that schools are coming up with. And all of these things work against our kids, right? The quality of teachers is going to be in flux for a really long time. We're actually going to experience a tremendous upheaval in the teacher labor force. Like, what we haven't even gotten to are the layoffs that are coming in the fall. That all of these state budget cuts are bringing. New York City is looking at up to $580 million in cuts. 90% of school district budgets are personnel. And so these are people who will not have jobs. Many of them will be our people who don't have jobs. And you can't talk about reopening the economy when kids are home from school or only in school for 2 hours a day online, right? That's to say nothing of the technological issues. Literally, it just goes on and on. And our kids already need more school, need better teachers, need better instructional materials. We don't have that. And so the folks who are going to lose the most as far as education is concerned are minority and low income students.
And so one of the things that I think is fascinating about the sort of holistic web you just described for us is really attending to not only this coming fall, but the ongoing impact this moment will have in education for years to come.
Absolutely. I mean, it is going to take us decades to recover from this. We have to rethink schooling, in fact, because we'll get another wave of this in the fall. And right now, everybody is trying to just get back to normal, get back to as close as normal as we had before. But in fact, when the second wave hits, I think it's going to force people to begin to think differently about how we organize school, how we think about deploying our human resources against this massive challenge. I think we will get creative for sure, but we're not creative yet. And there are whole swaths of kids who we're not even touching. There was an article in the LA Times about 40% of kids in LA Unified who haven't even logged on. They don't know where these kids are, right? Mm-hmm. There are kids who are working because they need to support their family. To Chris's point about multi-generational households, like, we take care of our families. And so there are significant implications on how much education is able to happen when there are multiple kids in a household and somebody's taking care of grandma. And I mean, we know how complicated our lives and our situations are. And I think I say all the time that, like, school is the stage on which all of society's problems play out. Schools are not equipped to deal with schools don't even do teaching and learning really well. And now we have to be responsible for kids' social and emotional trauma and addressing that. We have to be responsible for all of these new health imperatives that we're not experts on, right? And so the toll that it's going to take on schools, all the while teachers have kids too and are trying to figure this thing out, right? And so it is just a colossal train wreck. And I don't think that we are thinking about this in the way that kids show up. Like, kids are not single issue people. It's not just about what do we do to improve teaching and learning. It's how do we integrate the healthcare experts with the educators to make sure that we're taking care of that? How are people who are planning for the reopening of the economy thinking about the educational aspects of it? Because you can't open a whole bunch of stuff if kids are not going back to school. I think that we are losing the opportunity to think collectively and intersectionally about these issues, and it all ultimately falls on schools, and then we wonder why schools can't fix it all.
Now, that's really helpful, and I think that's part of what's exciting about this conversation, because we have folks from different specific expertise, but that also are trying to think across these different concerns. And so, you know, Charlene, your work really foregrounds this intersectional approach. I wonder if you could talk specifically about some of the impacts you see for Black businesses as the economy is trying to reopen, and then perhaps you could also address the advocacy work that you're doing with regards to healthcare workers in Arizona, or at least testing, and, you know, the broader implications for supporting Black communities via advocacy.
Absolutely. Let me start first with telling you a little bit about Arizona. With the Black AZ COVID-19 task force, part of the impetus was behind forming the task force is our real concern about whether or not there would be equity for Black Arizonans. As of today, we have 59,974 confirmed coronavirus cases in the state, 1,463 fatalities in the state. We are expected to run out of our ventilators, emergency beds in the next, by mid-July. Our big concern, again, was that we are such a small percentage of the population. We're about less than 6%. However, we make up more than 13% of the homeless population and more than 20% of the prison population here. We are overrepresented in terms of the unemployment rates. The achievement gaps with our students is significant. So a lot of what Kaya was saying in terms of the technology, lack of access to Wi-Fi, whether or not our kids were going to have meals throughout the summer months, whether or not there would be a spike in eviction and more also a spike in terms of utility shutoffs and what that was going to look like to our community. Also, because we are such a small population, we don't have a very wide network in terms of communication with radio, television, and or print media that communicates and engages the Black community. So it's very important that we come together across the state, find a communication method to be able to do that, and then lobby our governor to release race and ethnic data in the testing, which we are still urging the governor to do. We've been demanding that we have testing within the Black community. We are still urging the governor to do that and to make those resources available. We've also been lobbying to have a statewide task force that would engage frontline members of the communities of color so that we could make sure that our communities had a voice, not just in terms of getting health services out to our community, but food boxes and technology, and then also financial resources that were coming in from the CARES Act. Our state has received $1.9 billion. Those decision-making tables do not have Black faces at them. So it is very concerning to us that we are oftentimes marginalized and even further marginalized in circumstances where we're dealing with financial and economic crisis. In 2008, 53% of Black wealth was lost. We are anticipating that that will be a similar cycle with COVID-19. When you ask specifically about Black businesses, it was anticipated that about less than 95%, actually 95% of our businesses did not receive funding from the PPP. So that leaves these businesses in a position where they are now needing to go to their state and or to local and nonprofits, their local city council and local nonprofits, in order to try to come up with creative types of funding for small businesses. The challenge with the African American community is that many of the federal dollars, actually none of the federal dollars, can be allocated based upon race. And so you have these very unique classifications like immigrant, documented, undocumented, refugee, homeless, poor. But race, African American, it's an actual racial classification that violates federal distribution of funds. And so what we've been kind of having the conversation with our council and our governor about is how do we create carve-outs to ensure that the Black community will receive funding and resources, emergency assistance for our small Black businesses, utility assistance for those businesses, And that has been a very disturbing and challenging conversation to have, because what the city and the state are doing is they're allocating funds based upon census tract. So when you allocate funds based upon census tract, and we're less than 6% of the population, that means we're typically at the back of the line. We're the last to know that the dollars are available. We're getting the least amount of community outreach and engagement dollars. And so organizations like the task force, which is all volunteer, are very critical to help, bring a spotlight to what's happening, but also to make sure that, our community knows where dollars are. I also wanted to give you some other data. Black families have a median net wealth of $17,150 compared to white families' median of $171,000. Our poverty index is 43%. So 43% of Black children are living in poverty. More than 73% of our children are still in single parent households. We do have Black businesses, women-owned businesses that are established at 5 to 6 times the national average. But what we're seeing is the average annual earnings of those businesses are coming in at about $28,000. So our Black women-owned businesses are making about $28,000 a year. And so, of course, if they're applying for PPP funding and they're being denied that funding and then lack other outlets to go after dollars, it makes it almost impossible for those businesses to survive. We also see that the median wealth for white families with advanced degrees is almost $300,000 more wealth than Black families. And so we do know that there is a huge economic inequity that existed long before COVID-19. COVID-19 will only further that chasm that exists between Black businesses and white businesses. We also saw with the PPP that there were a lot of restrictions. And so many formerly incarcerated business owners were not allowed to apply. Banks set their own criteria for whom to lend to and were incentivized to choose large clients over small businesses. So we saw a lot of very large companies that were going after those PPP dollars. People of color were also disproportionately left out. And we're not exactly sure how many. So that 95% of us is still an estimate. 25% of the initial $2 trillion went to big business bailouts. And that's something we also saw in 2008. Only a tiny fraction was set aside for the most vulnerable businesses and communities. And then we know that Black businesses have not had the relationships with traditional banks to establish lines of credit. We know that there's redlining that's occurred in our community. We know that we don't have these very substantial relationships with SBA. And so what we're seeing is just an economic crisis that, according to the U.S. Black Chamber of Commerce, we can anticipate that we will have a loss of more than 50% of our Black businesses.
Right, and so I think that one of the threads that you pick up from the previous responses is, although Black people are a smaller proportion of the population in Arizona, there's a disproportionate impact of COVID on them for being frontline workers because of the economic disparities that have been historic and entrenched structurally, and then the implication of access to economic drivers that have been activated by way of Congress in this moment, but that once again are foreclosed or at least more difficult to access for Black folks. And so I wonder if we could turn now to Tony to ask a question about the work that you've been doing really to address some of these disparities, specifically thinking about this moment and from a social justice lens, and then more, and then also thinking about how this moment draws forth trauma, as Kaya mentioned, and what we can be doing to redress the traumatic nature of this situation, and also to think about social justice as we move forward, or try to move forward.
Whew. So first, everybody take a deep breath on the traumatic nature of this situation, because by the way, pandemic, outside, and uprising, and 2020, by the way, and it's only June going into July. So for all of these things we're talking about, we're kind of just in the middle. Like when Kaya was starting to talk about like this next wave, like we all kind of have this sense, there's this feeling as it's warmer outside and we're seeing more people and we're feeling the hot spots. And if you're thinking globally, you're looking at Brazil and you're looking at the continent, like you're looking at like what's happening. And I want to kind of just think about my comments and where we're going, like in 3 different spaces. One route, so like racism, by the way. just to be clear, everything that we said is, you know, racism and like kind of that cultural, powerful, by every definition that we think about racism. Shout out to Merriam-Webster for actually changing the definition, thanks to a Black girl in in Missouri. But you know, that whole thing, this way that society, without being checked from an equity lens, will neglect, exploit Black bodies, Black people. Just, it showed up before with all of the different determinants we've talked about. It was there in place. So when those of us that were watching this, you know, back in December and January, were like, oh crap, we know where to go. This was all predictable, as many of the panelists have said, but I think we need to continually say, you know, it's racism in this larger cultural system, because, you know, yes to Kaya's grandma talking about like what, you know, now at this point, you know, it doesn't just give us a cold or the flu, it puts us on a vent and can put us in the grave. Like there's a whole daggone situation. But like, if there was ever a question as to whether politics and race played like an actual had a hand in what was happening with your body and your family, like this 2020 has been it to show us, you know. That being said, you know, when we see the systems, that means we can change the systems, right? And so, you know, thank you, Kaya, for mentioning like in the middle, this part about like what people are going through and the lived experience of this. And like, yes, jobs, yes, but like just the fight or flight is on like fire right now, just on fire with so many folks in terms of stress, in terms of burnout, in terms of grief, you know. So I'm in Bed-Stuy, Brooklyn, and have been operating as a family physician, wellness person. I've been doing consults and I've been working on global strategies. And, you know, when I convened with Morehouse a couple of weeks ago, a conversation of Black teachers across the country and Black nurses, like all in all, just kind of this conversation about like how hard it is, like how much of us are kind of triggered even right now, like how many times did, you know, the 246 people like on this webinar like feel that in their chest, you know what I mean, when we're thinking about our parents, when we're thinking about our kids, when we're thinking about our electeds. And so like it's really just important for us to all kind of just take a beat, you know, even in terms of our mental, physical, spiritual, and economic wellness, but definitely like our mental and spiritual, because without kind of this, you know, this kind of grounding and kind of this moment in who we are and what we need, all of the rest of it just flies. And by the way, my doctor side knows that like underlying most chronic diseases, underlying all of these stressors is just the constant stress of racism, whether it's microaggressions and traumatic stress, or not being able to be clear about where your shelter and food and all of those things are coming from. So definitely take a beat in all of your spaces to like think about the wellness of you know, our children, our elders, all of us, right? Because there's the flip side of being called a healthcare hero is that folks think that you are immovable, unshakable, which is another kind of one of those like things that racism loves to do with Black bodies, neglect us on one side, but then ask us to save the world, you know, whether you're a home care worker or running for vice president, you know, you are, I mean, Breonna Taylor, right? Like serious essential worker out there doing a daggone thing, trying to get rest and got killed. And so, you know, shout out to all of the people in the streets actually raising the cultural wind around racism and all the things we need to do, and raising the conversation on accountability and investment and divest. But like to the entire panel's point about like, where do we go next? Like this, so just to think about the fact that like with everything we just said and how it sits in our bodies and our minds and the spirits, one of the things I've always loved about my Georgetown family is the ability to kind of get in a room and get on the phone and think big, broad, and about changing like the whole daggone thing, you know, like the entire daggone thing. And, you know, this potential missed opportunity, because, you know, we're tired, we're on Zooms back to back, you know, we're dealing with our families and figuring out our budgets. And, you know, if you're a small business owner like me, figuring out how to pay your folks and the insurance and all the things. But innovation is one of those things that needs some space to be created. So in Brooklyn, we actually have where we got hit really, really hard, because the lived experience from the beginning was that essential workers were being told to grind. And by the way, 2.5 million people in Brooklyn. So if you consider that there are 1 million essential workers around the country, most of them that look like, around the city, most of them look like me, you can tell people to social distance all you want. Like, if I walk out into my block in the middle of Bed-Stuy, like it's like Oregon Trail out there, like trying to figure out how to get back and forth. And so the disconnect between what was being said about how to save yourself and what Black and brown people were being asked to do every day without PPE and grinding was such a thing. But with that and our history comes like our history of not just resilience is such a tricky word, but let me just say strategy, right? Because we know resilience in the hands of good-meaning folks who or folks who want to maintain this racist structure is just another way to put a Band-Aid on and not do what they need to do. But resilience and our brilliance and our strategy is an entirely different thing. So I like using the framework of moving from the initial shock phase of COVID to adaptation, which all of us have had to figure out. And then, you know, let's move to kind of liberation, let's move to planning, let's move to innovation, those different things. And so in Brooklyn, with the Department of Health, with multiple community organizations who, the minute we saw that no one was coming to save us, that comfort ship wasn't being pulled up to like Bed-Stuy to help folks, wasn't going to Queens, that big ship that our governor and our mayor start talking about, community organizations started getting it, started figuring out the food, you know, kind of distribution situation. Me and my wellness tribe started talking to folks about meditation, started pulling up the ancestral and traditional practices of herbs that help people work with their immune systems and be ready to see when COVID knocks at your door, but way before you even would get to event. In like different ways of working with children, different ways of working with education, providing different spaces for like safety in the face of everything else. So I think the way that we as, you know, Georgetown alum, or as folks that even have the privilege of the space to think about this from 12 to 1 on a Thursday, to mindfully create space to kind of, you know, figure out what those best practices are. How have we already adapted? And how do we already know what we need for the next phase? Because I promise you, Kaya could get like 15 people on the phone right now and be like, look, if you give me this investment, this is how we're going to build the system of fall 2020, let alone like beyond. But like, it's time. That takes intentional like creation, intentional time, intentional space. Like, you all know what innovation is. And that's kind of, I think, what we are called to do. Like, take a pause and see what's going on and listen, and then like lead on it. Yeah, those are just my general thoughts.
I love that. Thank you. I mean, one of the things that there were so many, they were very rich. And one of the things that you highlighted, which I think is worthy of underlining, is that, you know, in beginning by saying racism is both a slow and quick death. We know after the death of Michael Brown with the federal government's investigation of Ferguson, Missouri, that there was a structure that was put in place to daily harass the citizens of Ferguson, which created the foundation that then became and resulted arguably in Michael Brown's death. And so when we see COVID's disproportionate impact, the structure of the health system and the structure of Black people being and brown people being disproportionately frontline workers, which is an economic structure, is part of why we see the results that we have. And not having access to equitable education, which then feeds into economic opportunities, is part of the structure that we see happening here. And so when we think about the quick death of COVID, there are slower deaths that are anticipating this moment, as you've already said, Tony. And so we have to think both about how we can care for one another in this moment, as you said, in this traumatic moment, but then also how we can restructure things moving forward so that we're not in this position where we see these impacts coming by way of racism. And so to the point of strategy and planning, which I love, we have some questions that have been coming in from our listeners, from our viewers. And one of them is really asking us to think about what was proposed by Christopher, what has been proposed by the whole panel, of a more integrative approach to healthcare. And so the question is, we often hear about merging physical health and behavioral health. Do you think it's possible or likely that this country will ever do the same for social determinants of health, i.e. merge it with physical health as well as incorporate it with COVID? And so this is speaking to some of the questions and or provocations that you all offered about thinking across the different systems, economics, education, obviously healthcare, advocacy. So anyone can start, but really, do you see what would be the path forward for having a more integrative approach to the problems that COVID draws our attention to?
Sure, I'm happy to start off with this. That's the world that I dream about, right? We have to evolve. There's this national conversation currently underway about systemic racism, particularly in policing. Well, you know, we have a similar conversation in healthcare. We have to have this conversation. We know that this shows up in practice. There are many examples, but there's one that comes to mind, and I'm going to answer your question in just a moment, but I want to set the stage. Even today, it is common practice for med students they're taught to make clinical decisions or make inferences based on a person's race. That compromises quality of care, and it is another reason that people of color distrust the healthcare system. So, as we think about tearing it down, I love that, Tony, tearing it down and starting all over, instead of emphasizing race, it's important for us to make strides toward a new model of care that has the capacity to integrate social and environmental conditions as part of clinical assessment and treatment protocols. And COVID is a perfect example of why it's important for us to move in this direction. People are not dying from COVID because of a biological difference. They're dying because of social and environmental conditions that put them at high risk. Their death is an outcome of systemic racism. So thank you for asking that question. And that's a big part of what my work is about. It's about integrating these social factors in clinical systems of care. That's going to get us where we need to be, and we need to be careful with how we're using race to make clinical decisions.
Thank you.
I love that. And yeah, so racism did it. And there's power there, which means building this system first means understanding that the system was put there deliberately. Like this idea of separating education and community and ancestral practices and midwifery, like that all started. Abraham Flexner and the Flexner Report, like in the early 1900s, like decided that, like, you know, medicine should be run mostly by white men. Women should not be doctors. Black folks should not be doctors. You know, marginalized natural practices. You know, and a lot of people have heard about Marion Sims. So like the entire healthcare system right now is not accidentally designed to make you think that all you need is a white man in a white coat in a building. It is deliberately designed, you know, at the turn of the century, after a couple of decades of, oh crap, we got a bunch of free Black people, let's figure out how we can separate this out, you know, to be this particular way, which means it's going to take power and intention to change the system, right? So how is that being done? There are multiple ways where people are doing it in different spaces. I mean, even if you look at the book Body and Soul by Alondra Nelson, it talks about, you know, the Black Panther Party and like the role of medical apartheid. If you look at Dr. Colbert's work, you know, even, I mean, Booker T. Washington started like Negro Health Week back like at the same time Flexner was doing the report to say we needed to be looking at water and jobs and sanitation and all of these things. So as long as there's been racism in our community, because our lived experience has been that like our health is not just the doctor's appointment, it's, you know, the food on our plate, the garden outside, what's going on with our children, what's happening with grandma, what's going on with pregnancy. It's always been intersectional for us, you know? So I actually, I chair the National Advisory Committee for the Robert Wood Johnson's Foundation's Culture of Health Leaders program, where they're like grooming folks to kind of think about health. And we all remember kind of the health in all policies type thing, you know, where you've got everywhere from artists to gardeners to urban planners to lawyers to, it's, you know, anyone who's called to figure out what their role is in this time to change it should be called in and given the space to create. So like that program, I would say, you know, take a look there just to get some ideas on how people are doing it from an individual leadership level. You know, in Brooklyn, we do have this consortium, this table we've pulled together that's everyone from the kind of cure violent street folks to the folks who are doing the urban gardening, to the wellness folks, to like the, you know, the kids advocates, to our elected officials, you know, our community boards, you know, and like on all of these things, like, can we just always shout out culture, art and culture for helping us to imagine and create, to helping us heal and to helping us love up on each other. There's a reason why there were 250,000 people on D-Nice's, kind of quarantine thing. And it wasn't because we were just miscellaneous about it. That was like strategic joy medicine that we needed. And so in all of these spaces, whether it's joy as kryptonite for racism to help you kind of think about how worthy you are to even create like a next, one, or it's art and culture and actually paying and putting money into the pockets of artists who are helping us all like a lot of us stay sane, in this moment, and engaging them, in the conversation around what it is we build, or deliberately and intentionally kind of engaging artists in the way, arts and culture, in the way that we prepare for our next and imagine, because the futurists will tell you all the time that like a lot of times it's artists that will tell you what's happening first. But like, especially if you think about it from an Afrofuturist lens, in terms of what's the world we want to create, if we're moving towards joy and liberation and the dopest school ever, and the most exciting, you can drop it like it's hot when you're 80 space, like the things that like we can't even imagine right now because we're so tired. Arts and culture can kind of, create the space for that. And then we can bring in the folks like, Christopher, who's got like, all the deets of the, yes, let's put this money here, and Kaya, who's done these things all over the world, and Charlene, who's, holding it down and like our hotspot right now, and all of us can create. So yeah, it is possible, but it's gonna have to come with hardcore power because that system wants to stay exactly that way.
Absolutely. I just wanted to chime in and also add that as a part of the intersectionality, we also need to be looking at the law, because we know that when we see these disparities, more likely than not, our community is going to have an increase in terms of evictions. We know that there will be a disproportionate impact of officers engaging young Black men around this. One of our big challenges early on was that our governor identified every profession as an essential worker or essential profession. They closed down our city parks, but were advocating to keep open the golf courses. And so we know that when you close the parks down, once our kids are out and they're roaming in the streets, they're more inclined to have interactions with law enforcement. They're much more inclined to be arrested and to be charged. And so just making sure that we're always keeping the law as a part of that conversation, and making sure that, we're looking at the legal implication of poverty, of health inequities, of economic inequities. And that's something that we don't often think about. We actually partnered with Community Legal Services to challenge the Department of Health to release the data. Early on, and this is to release testing data, race and ethnic testing data. Our governor created a very extensive executive order that said you can qualify for an eviction moratorium if you can prove that you or someone in your home has contracted the coronavirus. Well, we all know that most folks could not go to the doctors. A lot of our community is uninsured or underinsured, and we go to the emergency rooms for healthcare, and they were being turned away. So we knew that they could not go to their physician in order to get a prescription to go and get tested for COVID-19, which means on the back end, they weren't able to actually produce proof that they had COVID in order to stay in execution of eviction. So around the state, in the midst of the pandemic, Arizona was still conducting virtual evictions. And so really being attentive to what's happening from the legal or through the legal lens around these inequities, I think is very important.
Can I just spin that a little bit? I mean, we talk about these systems like they are these institutions. They're actually people, right? The governor made a decision about golf courses versus parks. The Department of Health made a decision to release stats or not release stats. These are people. In many cases, these are elected officials who wield all kinds of power. The power to actually bring us together in an intersectional way. I couldn't do the work that I did at DCPS if we were not under mayoral control, which meant that the mayor got to direct the relationship between education and the Department of Health. And so I could have the Department of Health manage all of my school clinics. They are experts in that. Schools people shouldn't be managing health clinics, right? I could partner with the Department of Behavioral Health to staff my schools with mental health clinicians. I could work with the Department of General Services to deal with my buildings and whatnot. So I didn't have to deal with that. You have mayors and city council people who could actually bring these things together in really meaningful ways. The whole entire response to COVID, good, bad, or otherwise in the United States, rests on the performance of your governor. If you had a good governor, you had a good response. If you have a not so good governor, you have a not so good response. And the presidential race, the federal races are hugely important, but we don't come all the way down ballot. Sometimes it's the local commissioners who are making these super weird decisions that have incredible impacts on us. And not only, I mean, we could all make the case for why we need to vote, but I'm gonna go a step further and say we need to run. If we are not the people sitting at the table making those decisions, right? As somebody said, there's no black faces at the table when they're making these decisions, and we shy away from public service. We don't want the scrutiny. Yeah, it's hard, but the only people who can save us is us. If we are not actively engaged in making the decisions, if we're not actively engaged in the positions of power, then we're going to wait for other people to make decisions about our community, and that's why we are where we are.
And Kanya, I want to piggyback on that. You made the comment that it's good governors and bad governors, and I want to say it's Republican governors and Democratic governors. It's red states and blue states. The states that are having the spikes right now are the red states. The states that made their capitalism, their business the first priority, and not health and the safety of our families and of our communities. We knew that in Arizona, they were lumping data. They were counting data twice. We knew that our community was not being tested, and not just our community, no communities were being tested. Our governor brought in the National Guard, and they were literally stocking grocery store shelves at Walmart so that folks could get in and get their groceries. And so for the first time, I think in my adult life, it has become very clear to me the difference between being in a state like New York, where you do have a blue governor who is very much about the people and investing in healthcare and access to resources and opportunity, versus being in a red state. And we are a state here in Arizona, and I agree with you also on the issue of running for office. I'm running for the Maricopa County Community College Governing Board. I think it's very critical. I live in a county where we have the highest incidence of disconnected youth in the nation. I'm listening to folks from New York and DC, and we have the highest incidence right here in my county. We also have the highest incidence. We have homelessness, we have refugees, we have undocumented immigrants, we have a small population of African Americans. And you're right, it's going to be us that saves our community. It's time for us to stop being told to vote, because we do vote. We need to run, and we need to support that. That is what's going to bring about the change to the system of racism that so many of us encounter and experience. It's time for it to stop.
And so,
I'm sorry.
Oh, no, it's okay. I was just gonna pick up on a thread that came from a question related to what everyone's saying, which is, what do you think the question is, what do you think the impacts of the federal government's messaging around COVID have been on Black people specifically? But I wonder, as a tag on to that question and what this conversation has unfolded, is if we could talk some about what we think the federal government could be doing. And we're, a couple months away from an election, so who knows what we're going to get. But if we were to imagine what a different response was from the federal government, or one that might be more attentive to the specific concerns we've been highlighting in this conversation, what would that look like?
I think we shouldn't wait for the federal government. They have demonstrated to us over the last 6 months that they are not prepared to help with this crisis. And in fact, as Tony said, there are local people out here doing it every single day. I think that, when people ask me what's going to be the difference in education moving forward, parents have seen an unprecedented peek into what is really happening in classrooms, and they are not having it. They're not having it. And that's right. That parental demand is going to push the education system to do something it has never done before. We are taking care of each other. And so I think it is foolish to wait for or imagine that the federal response is going to be different. This man has shown you who he was, who he's been for the last whatever, 2.5, 3.5 years. And so if you're not organizing within your community, if you're not organizing within your town or your city, then shame on you. We have to save ourselves.
And
No,
I
that's
appreciate
real.
from Kaya, your comparison of this moment to what unfolded after Hurricane Katrina. Charlene, did you want to add something?
You know, I agree wholeheartedly with Kaya that we are at a very critical point right now. I don't think we can belabor that. For those of us who live in much larger communities with larger populations of African Americans, you all are so much better qualified and better positioned to deal with the rollout of this. I know for us, we have been reaching out to New York and to DC and asking, would you share some of your PSAs with us, share information on the coronavirus and hand washing techniques, and can we get experts that will join our weekly calls? Can we, highlight some of the information? Do you have flyers and brochures? And, this is a time for us to not just stay localized within our communities, but for us as African Americans to reach across this nation, because there are so many of us that just don't have the resources and the access that you have. And when you say, let's not wait on the governor, you're correct. But we are so insular that we need to be able to rely on our African American communities across the nation in order to get the services that we need. And when I say things are dire, it's dire. I watched our governor refuse to shut the state down very early on. We were one of the last states to shut down, and we were one of the first states to reopen. The governor was very opposed to issuing a stay-at-home order, and in less than 24 hours of a mall being looted in Scottsdale, as it relates to a lot of the Black Lives Matter marches around George Floyd's death, in less than 24 hours, our governor had issued a statewide lockdown. And so what it says to me is that government has a tremendous amount of power. And so who represents us is critical. But we do need to reach beyond just voting and supporting candidates in our local communities to really galvanizing the Black vote across the nation. So I'm going back.
I'm gonna jump in because I'm gonna speak to the both and here, because absolutely we have to do it on the ground. Like, we have to take care of us. Ain't nobody coming to save us. And to be clear, I want to make sure we talk about Kaya's point about the down ballot thing, because as a Black doc in Bed-Stuy, I would urge you to look at like Jumaane Williams' press conference with like Black and brown elected officials around the country about how resources were not coming into Brooklyn. So those press conferences that talk about how great it is and how great New York is doing, don't talk to nobody in Brooklyn and Queens about that shit. Excuse my language, So there are those general kind of spaces. And the reason the data even got pushed up across the country is because there were a group of Black doctors on a WhatsApp pushing it, like beating people to get it out, because folks didn't want it out because they were afraid of two things. One, that the narrative would be like, oh crap, and here would come the militarization, which we saw, or two, it would just be an excuse to not, all of the things that happen. I love Ava DuVernay's title, When They See Us, like that thing, but we're like, no, we got to be able to see us to be able to save ourselves and take care of ourselves. So the biggest challenge right now for me, having worked on the Ebola epidemic, where we have multi-directional support, people were feeding from the ground and all of these things, and now is that when I go out on my block and I'm talking to folks about COVID, I have to deal with not only the facts as I know them as a Black doctor, brilliantly informed around the country, but I have to beat back all of the nonsense of all of the other stuff they're hearing, which is why the community organization, that kind of having the trust brokers in your community know and always share the facts, is like the key thing to us like living. And so that is our elected officials that know who we are on the block. That's us running for things, but that's also like the Black auntie, you know what I mean? Like, make sure the Black auntie has the facts and isn't having to fist through Fox News, the president's press conference, and 15 flyers, And so meeting people where we are, that basic community organization stuff is like the hardest thing about the crazy surround sound. And like, because when we talk to each other, we know our lived experience. We know what we need, and we know how to adapt to fix it. And that's how like we need to be doing things.
So just one quick follow-up for Tony, and then I have a final question for everyone. So the question came in about how we might apply these strategies in rural communities, and I think that piggybacks on something Charlene was saying. So could you just quickly give us an insight about how we might translate some of the strategies you described in rural contexts?
No, absolutely. So my mama is in a town with 900 people. So trust, that happens every morning. It happened right before this call. So what that is the same kind of finding the trust brokers and the people. So I know the folks who she taught in high school who are the nurses, you know, at the hospital that may be in the middle of a red state, but like they know what they know what they know. And they convene, there's so much kind of virtual sharing of information right now, and also community sharing of like these techniques of how to stay safe, people passing out masks, people dropping off food, that like there's just a different kind of, I mean, that's the country way that I grew up. So it is kind of having folks to build that network amongst the folks that care about us, you know, whether that's the next county, upstate, or whatever. And I know my mom in rural Southern Illinois is surrounded by like hot states, surrounded by Kentucky and Tennessee and Missouri. So we have actually a strategy for her for every part of her health that includes like, you know, who are the people that can come get her, who can bring her food, what does she need? And, you know, she's reaching out with her sorors and her church and the whole nine. So, but yeah, it's the same, finding your trust brokers and finding your people beyond the system and connecting in different ways, whether it's on the phone or virtually.
Mm-hmm.
Can I just add to that, you know, we're seeing this proliferation of telemedicine, televisits. That didn't exist before. That's one of the lessons learned from COVID. Before, there was all these restrictions around reimbursement and televisits and telemedicine. And so a lot of that has been removed, and we have learned that, wow, this is effective. It does work. So that's exactly. So that's progress. And I think we'll continue to see more and more movement in that space.
I also wanted to add in the rural community, one of the things that we saw with COVID is that because it cut across so many multi-generational levels, we needed to make sure that we were engaging our young people as well as engaging our seniors. And so putting together a bi-weekly email with hyperlinks so folks can actually click and access resources, whether it's food boxes, unemployment assistance, rental eviction assistance. We have a weekly call that we do, making sure that folks are able to hear a voice and they're hearing from frontline decision makers. We've had our county recorder get on and talk about how we're going to handle mail-in ballots. Our mayor has provided updates. We've had folks come on who've talked about the homeless population. Our sheriff has gotten on the call to give us an update on the prison population. So really engaging those frontline elected officials to have them come to the community and talk to the community to lessen some of the anxiety. We also built out a social media platform, Facebook, Twitter, and Instagram, because we know that's where our young people, we wanted to educate them about the proper hand washing techniques and give them a space where they could be able to engage us, because so many of them are not in the church. One of the first things that happened with COVID, the churches closed, the church doors closed. They weren't able to distribute food. They weren't able to connect with their congregations. They didn't have the AV equipment set up. And so it became very critical. And I think it continues to be critical for our smaller communities, our rural communities, to identify communication strategies and use technology to connect with one another.
And so, you know, just piggybacking on that the last bit about connecting, what is one thing in one sentence that you would suggest we can do to leave our guests with action steps for responding to the structural inequalities we've named? There's so many things that one could do, but if you want to highlight one thing, what would that be? So maybe Chris, we can start with you.
I'll make it 2 words: be anti-racist.
Thank you. Kaya?
I need a minute, sorry.
Okay. Tony?
I would say, you know, take a moment to get quiet with yourself so you can know who you are and what your spiritual assignment is for this moment, and then go hard, go hard at it.
Charlene?
Support strong Black candidates across this nation. Support strong Black candidates across this nation, politically. Through your dollars.
I would say make our demands known, right?
Mm.
The Bible says you have not because you ask not. And we're so busy waiting for somebody to deliver for us instead of going out here and demanding and taking. And we've seen significant shifts in the conversation around policing because we've made demands differently. And I think we can make demands about education differently. I think we can make demands about healthcare differently, about voting and leadership and whatnot. And I say make our demands known.
So we have our homework. I want to thank our panelists for taking time out of their day to share with us their brilliant insights. We appreciate you joining us. And as Chantal explained, this webinar will be available to all of us via recording on our YouTube channel. So thank you again. Have a great afternoon.
Thank you. Be well, everyone.